Imagine this. You're in your 20s or 30s, feeling invincible, hitting the gym, grinding at work, maybe even scrolling through endless feeds late at night. But lurking in the shadows of your next doctor's checkup is a number you might be ignoring. It's not the top one everyone's talking about. It's the bottom one, your diastolic blood pressure. And guess what? For young adults like you, it could be the silent killer hiding in plain sight. Studies show that even a slight bump in this hidden number can spike your heart attack risk by up to 32%. Stick around because today we're diving into why diastolic matters more than you think, the risks you can't ignore, and simple hacks to take control before it's too late. Let's break it down. First things first, let's demystify blood pressure. You know those two numbers from your reading? The top one's systolic. That's the pressure when your heart pumps blood out. The bottom? That's diastolic, the pressure when your heart relaxes between beats. For young adults under 50, normal diastolic should hover below 80 millimeters of mercury. But here's the plot twist. While systolic often steals the spotlight as we age, diastolic can be your early warning system in your prime years. Think of it like this. Your arteries are like highways. High diastolic means constant traffic jams, even during rest periods, straining your heart and vessels. A massive study of over 6 million young people found that if your diastolic creeps into the 80 to 89 range, even if systolic is fine, your risk for heart disease jumps significantly. It's like a slow-burn thriller where the villain builds tension quietly. And get this, in your 20s and 30s, this hidden pressure is often fueled by modern life, stress from deadlines, salty takeout, or skipping workouts. But why does it hit young folks harder? Because your arteries are still flexible, so diastolic spikes signal underlying issues like inflammation or poor lifestyle choices that compound over time. Now, let's get into scary stuff. But don't worry, knowledge is power. High diastolic isn't just a number. It's a red flag for serious trouble. For instance, it can lead to coronary artery disease, where your heart's blood supply gets blocked, increasing heart attack odds. One eye-opening report from the American Heart Association highlights that young adults with isolated high diastolic, normal systolic, elevated bottom number, face a 36% higher chance of cardiovascular events. And strokes? Yeah, diastolic's linked to brain vessel damage, potentially causing those white matter lesions that mess with memory down the line. Picture Sarah, a 28-year-old marketer, always on the go, caffeine-fueled. With a diastolic reading of 85, she brushed off. Fast forward a few years. Subtle fatigue turned into a wake-up call after a minor heart scare. Stories like hers aren't rare. Nearly 1 in 5 young adults deals with high blood pressure today, often undiagnosed because symptoms like headaches or dizziness get blamed on just being busy. Men might feel it more acutely, but women aren't immune, especially with factors like birth control or pregnancy adding layers. The real danger? It's asymptomatic for most, earning the silent killer badge. Left unchecked, it ramps up kidney strain, vision issues, and even erectile dysfunction in guys. But here's the hope. Catching it early flips the script. All right, time to arm yourself. Lowering diastolic isn't rocket science. It's about smart swaps. Start with monitoring. Grab a home cuff and check weekly. Aim for under 80. Diet's your first weapon. Slash sodium to under 2,300 milligrams a day. Ditch the processed snacks for potassium-rich bananas, spinach, or avocados. The DASH diet? Gold standard. It's proven to drop diastolic by 5 to 10 points in weeks. Exercise next. 150 minutes a week of moderate stuff like brisk walks or cycling. But add strength training. It boosts artery health. Stress? Tame it with mindfulness apps or 10-minute meditations. Chronic cortisol spikes diastolic. If you're a smoker or heavy drinker, quitting can shave off points fast. And weight matters. Losing just 5 to 10% body fat makes a difference. If lifestyle tweaks aren't enough, chat with your doc about meds like ACE inhibitors. They're safe for young adults. Remember, prevention now means dodging big issues later. You're young. You've got time on your side. Use it. So young and at risk? Absolutely, if you're ignoring diastolic. But armed with this info, you can turn the tide. Don't wait for symptoms. Get checked, Make changes and own your health. If this hit home, like, subscribe, and share your BP story in the comments. Stay healthy out there.